Now we are going to be live on a topic that is ARFID or avoidant or restrictive food intake disorder. We will simply talk about this. Avoidant or restrictive food intake disorder is simply called ARFID. ARFID or avoidant or restrictive food intake disorder is a condition that limits your food intake. It is not caused by a negative self image or a desire to change your body weight. Fear and anxiety about food or the consequences of eating, like choking, can lead to ARFID. The main treatment is cognitive behavioral therapy. In this topic, we will just discuss overview, symptoms and causes, diagnosis and test, management and treatment, prevention, outlook or prognosis. Leaving with an additional common questions on ARFID or what is avoidant or restrictive food intake disorder. Now, our question is what is avoidant food intake disorder or what is restrictive food intake disorder or ARFID? Avoidant or restrictive food intake disorder (ARFID) is a condition that causes you to limit the amount and the type of food you eat. It isn't the result of a distorted self-image or an attempt to lose body weight, which is common among other eating disorders. ARFID can cause you to lose interest in eating, feel anxious about the consequences of eating, like choking on food or vomiting. Avoid foods that have an unwanted color, taste, texture, or smell. You might hear your healthcare provider call ARFID selective eating disorder. This is because you may only choose a few things that are okay to eat. You may also create rituals or patterns of behavior around the way you eat, like eating your food in a specific order. ARFID can affect your nutrient intake, which can affect your overall health. It may lead to life threatening complications if left untreated. Now, our question is avoidant or restrictive food intake disorder the same as picky eating? No, the answer is a big no. ARFID or avoidant or restrictive food intake disorder is not the same as picky eating. Children may be and may avoid certain foods because they don't like the look, the taste, the smell, or the texture. Picky eating usually only targets a few foods that doesn't affect your child's appetite or their growth and development. Picky eating can also go away as a child grows. ARFID can cause complications that do affect your appetite and overall health due to a lack of adequate nutrition. This condition doesn't go away without treatment. Now, our question is how common is avoidant or restrictive food intake disorder or ARFID? An avoidant or restrictive food intake disorder or ARFID is a newer diagnosis in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, simply DSM-5. This means that there's not a lot of data available to estimate how this condition affects a large scale population. Symptoms and causes of ARFID, or the question is what are the signs and symptoms of avoidant or restrictive intake disorder? Signs and symptoms of ARFID include 1. Weight loss, significant weight loss. 2. Constipation. 3. Abdominal pain, stomach cramps, or an upset stomach. 4. Low body temperature. 5. Lethargy. 6. Irregular menstrual cycles. 7. Fainting or dizziness. 8. Fine hair on your body, lanugo. 9. Muscle weakness. Besides these, there are some behavioral changes that may be a sign of avoidant or restrictive food intake disorder that include feeling full before meals or having no appetite, difficulty paying attention, limiting how much food you eat, only eating foods with certain textures, fear of food, fear of what could happen after eating, like vomiting or choking. Picky eating gets worse and limits the range of foods available to be eaten. ARFID is not associated with a negative body image or a desire to lose weight. Uh, when you are suffering from ARFID or avoidant or restrictive food intake disorder, signs and symptoms sometimes include lethargy, significant weight loss, dizziness, and thin body hair, and some behavioral changes that might be. The exact cause of avoidant or restrictive food intake disorder ARFID is unknown. Research suggests that it may be the result of anxiety, fear, genetic changes, social, cultural, and environmental influences, and trauma. Now, our question is, what are the risk factors for avoidant or restrictive food intake disorder? The answer is avoidant or restrictive food intake disorder ARFID can affect anyone, including adults and children. The condition is most common during childhood. You may be more at risk of developing ARFID if you had a traumatic experience, especially involving food, like food insecurity, force feeding, choking, etc., etc. To have an underlying condition that affects your neurological functioning or development, like anxiety, depression, ADHD, etc. Three, have an aversion to certain textures. Next, fear that food will harm your body. Lastly, have a biological family history of eating disorders. So that's all about the risk factors of avoidant or restrictive food intake disorder. Next, our question is, what are the complications of avoidant or restrictive food intake disorder or ARFID? The answer is, complications caused by avoidant or restrictive food intake disorder ARFID include: 1. Malnutrition, 2. Dehydration, 3. Electrolyte imbalance, 4. Anemia, 5. Low blood pressure, 6. Osteoporosis, 7. Cardiac arrest, 8. Delayed puberty, 9. Changes to your physical growth. The consequences of ARFID can be life threatening. Sometimes a person diagnosed with ARFID won't have any signs or symptoms because their body adapts to stress. It's possible that test results could be inconclusive even though the condition is life threatening. ARFID can also affect how you socialize. You may avoid seeing loved ones or participating in activities that are in the presence of food, like family meals, dinner parties, etc. This can affect your relationships and can even distract you from work or school responsibilities. Now let's have the diagnosis and test technique. How is avoidant or restrictive food intake disorder diagnosed? Answer is, a healthcare provider will look for certain criteria when diagnosing avoidant or restrictive food intake disorder or simply ARFID. They will make an ARFID diagnosis if the following are true. Limited food intake leads to significant